The pandemic has forced many changes in our approach to healthcare. Among the most dramatic is the shift in the point of contact for care from provider locations to the community, especially in the recent push to reach goals for vaccinations. That explains recent efforts by provider volunteers from Mass General Brigham to spread the message about the safety of vaccines and, most of all, how they can help. Our guest is one of the community messengers, an internist at Brigham and Women's Hospital, Dr. Paulette Chandler. Thank you very much for being with us, Doctor.
Thank you.
So I want to ask you about trust because when most of our community members, when we get care, we go to somebody we've met before, so at least we know what to expect. But what about the level of trust when someone you've never seen in your life comes up and says, you need a vaccine?
Well, that's definitely a big leap of trust. And so we know from data that's been collected in a variety of ways that the physician or other healthcare worker is one of the strongest messengers in terms of reliability, credibility, and trust. So one of the ways that we've been building trust in the community around the vaccine is having physicians and nurses deliver messages and answer questions in the community regarding the safety of the vaccine, the benefits of the vaccine, and other concerns that the community members may have that block them from being willing to take the vaccine.
Well, I know people know that there are some reasons, certainly historic reasons for distrust vis-a-vis the community and the medical establishment. But what about your own rounds as a messenger? Did you encounter some distrust?
Oh yeah, there's a lot of distrust, and of course there are historical reasons, whether you look at slavery, Tuskegee, or everyday experiences that people have of discrimination or challenges in the workplace, challenges in accessing care, or the legal system, the mass incarceration. There are a lot of different domains that people have that trigger distrust. And I think of one example. We were in the prison system in Suffolk, and we were speaking with incarcerated individuals about the importance of taking the vaccine. And one incarcerated individual or detained individual said, well, why am I first in line for this? I've never been first in line for anything else. And so what we emphasize is that this was a strategic plan. We know that individuals in congregate settings are at increased risk for getting infection and having death from infections. Outside of nursing homes, prisons were a major site of many loss of lives. So that type of distrust has been commonly, expressed even in the carceral system. That's one example. And so we address those concerns by emphasizing that they were prioritized for a reason. One, because of the high death rate in the prison system. Two, because of the congregate living setting. And three, because they deserve that protection since they don't have the opportunity to really practice physical distancing. And some of them were willing to take the vaccine after that conversation. And of course, we continued to have conversations in our incarcerated population or other individuals that are in congregate settings.
Were there any concerns raised by people who thought that the vaccine might somehow adversely affect some other health condition, which maybe there's a chronic illness, or maybe there's somebody who's pregnant? Were there concerns like that?
Yes, there were. Example, like one person told me, look, I already take enough medications. I don't want anything else injected into my body. How do I know that this vaccine isn't going to interact with the other medications I take? Others expressed concern about pregnancy. They said, look, I hear that this vaccine will kill you, but it doesn't kill you immediately. It takes about a year to kill you. And so I don't want to put myself at risk of dying and leaving my loved ones behind. Others were concerned, well, what if I get pregnant after I get this vaccine? How will this influence my pregnancy? How will this affect the development of my baby?
So, did you feel that you changed people's attitudes? Because these sound like these are very, hard and fast concerns here. This is not easy to sort of, snap out of it. So, what was it like for you?
So the important thing is to remember that this is a discussion. Individuals will often require multiple conversations. If they have hesitancy or distrust, they require multiple conversations before they eventually decide, okay, this is the vaccine for me. I'm going to take it. I want to protect myself. I want to protect my loved ones. I want to protect my community. And the one of the most important things is to approach the conversation with empathy, not as a know-it-all, but say, okay, well, I want to hear what this person's concerns are because they're valid concerns, and to acknowledge it is a step-by-step process. And if you approach it in that perspective, then it makes the person feel that they're heard. There's more listening than talking. I do more listening than talking. And then I want to make sure that I understand what their concerns are and see whether I can address some of the fears. Like if they say, oh, I'm afraid that this has a tracker. Once I get the vaccine, this injection will have a camera in it that will track me wherever I go. Or I'm concerned that this is a vaccine to try to decimate my community. So there are lots of different concerns.
And what about your own concerns? Because you're a physician, you're supposed to keep your eye out on things. Did you follow the research on this, scouting for any possible hazards?
I did. In fact, I was involved with the Moderna vaccine trial in terms of reaching out to the community, building relationships, and served as lead for community engagement and education on the vaccine. So the beauty of being involved in a clinical trial from day one is that we have the opportunity to have these discussions with the community regarding participating in the clinical trials. So I was able to follow, what types of side effects people were having in our trial and other trials. Of course, once you're actively involved in a clinical trial, there's great sensitivity because you're inviting people to participate in a trial, for example, Moderna, where messenger RNA had not been used on this wide scale of study in a clinical trial before. So I had concerns myself. I said, okay, I hope that people that I'm encouraging to participate in this trial will not have adverse side effects. And it seemed reasonable, though, based on the preliminary data that we had from phase 2 and phase 1 trials, that this would probably be a relatively safe way to deliver a vaccine. And also we had smaller, studies. So yes, when there's a vaccine trial or when there's a big vaccine rollout, like we're doing with these vaccines, there is tight scrutiny of data that's coming out. And yes, I keep abreast. And of course, within our institution, we had groups that were keeping us abreast of various side effects that people were experiencing. And of course, when you see a side effect, you pivot. For example, individuals that were having allergic reactions to the polyethylene glycol. Once we saw that that was a real concern, then individuals that had a history of that allergic reaction were advised not to take the vaccine. And those that had a history of allergic reactions to other vaccines were monitored for 30 minutes. And of course, the CDC has the Be Safe app also to allow individuals to enter their side effects. And for my own patients, of course, I encourage them, if you have any side effects, please let me know.
Well, with so many older people getting vaccinated in the earlier part of this process, it was easy for them to buy in because they were protecting their own health in most cases. But what about as we get to people who are younger, who might feel less vulnerable? Is it going to be more difficult to persuade them that they got to do this, even if it's not primarily for their own health?
Right. It can become a difficult conversation for a young, healthy person, but I find that several young, healthy people that I've talked with, they're actually quite eager to get the vaccine because they want to protect their loved ones. They want to protect grandma. They want to protect their parents that have underlying health issues, hypertension, diabetes, heart disease, lung disease, that might put them at increased risk for severe infection and hospitalization from that severe infection and death. So that becomes a bigger motivator. And then some young people, they've lost loved ones to COVID. And when they see that loved one sick, they can't visit them in the hospital, at least, back in the earlier days, then that was a real game changer for them. They said, oh, yes, I'm ready to get that vaccine. The other motivations for them to think about getting the vaccine is that they want to see the pandemic end. They're tired of not being able to just travel freely, although many of them are traveling, but they are still looking forward to being able to gather more freely with their friends and loved ones.
I know the way we cover healthcare in Boston, we're exposed to a lot of work by community health centers. So we keep hearing over and over again about the need for community engagement and cultural competency. But what is it like for you? I mean, is that loom larger for you now after what you've been through here with the past year of this pandemic?
Right. It is an important piece because we know that it's a lot easier to have these conversations with people that you've already been engaged with, that you are concerned about their other needs. Because some people say, well, yes, I may not die from COVID, but I'm still in this poor housing situation. I have no job. So I'm suffering from depression. I'm feeling suicidal. So will this vaccine help with these other social issues that are driving my poor health conditions? So it's it's important that community engagement move beyond just encouraging people to get vaccinated, but we want to make sure that we're addressing other issues that predispose to people being at high risk for getting severe COVID and being hospitalized. And so community engagement is really it's a long game. And yes, it's important for COVID because we know that if people have trust in the system, trust in a process, they're more likely to embrace the recommendations of organizations and the voices that they're hearing.
One of the things I noticed is that the messenger campaign more or less overlaps with the community vans that Mass General Brigham's had been organizing as well. And it looks like you have things going on that are very explicitly medical about hand sanitizers and masks, but also helping people with food. What was the reason for putting those together?
Right. Food insecurity is a big issue, and it really became explosive during the peak of the pandemic. Remember, kids would often get their meals in school settings, but with schools being closed, they no longer had access to those meals. So that's just one example of how food insecurity expanded. And then people lost jobs, so they could not pay for food. And some people have lost jobs that are not coming back. Businesses have closed. So we wanted to make sure that we address food insecurity because that is a big driver of disease prevention. A healthy diet, we know, helps prevent many chronic diseases, hypertension, diabetes, and others. The other aspect, though, we also want to make sure that we're thinking about how do we empower these individuals in the community to be able to generate income so that we don't have to worry about food insecurity. And that's a long-term process, thinking about workforce development, thinking about investing in entrepreneurs in our community and empowering these communities. These are strong communities. I mean, these communities have embraced, they're very resilient. And we want to think about how do we allow these communities to really excel and explode with their strength.
I want to ask you one more question because I think of you as being based at a hospital, even though I'm sure you meet people from the neighborhoods while you're there. But at the same time, getting out into the neighborhoods, did that feel different to you in some way?
Oh, it's definitely a different experience. I helped with the Reggie Lewis vaccination site. We did one weekend, February 27th and 28th, where we, had a crew of physicians and other healthcare workers that volunteered to vaccinate. And the community members that came out to be vaccinated were so grateful. And, some of them wanted to take videos of themselves receiving the vaccination and also talking with other organizations that were represented at the Reggie Lewis Center. For example, there was one community partner that was distributing kits that included a pulse oximeter and other things for monitoring COVID infection. And just the opportunity to talk with people face to face that I'd been seeing on Zoom meetings was amazing too. And of course, our mobile van was present to distribute information. And there was another organization, giving out soup. So it was an amazing experience to actually see people face to face.
Sounds like great therapy. Thank you very much for taking the time to join us.
You're welcome. Thank you.
Dr. Paulette Chandler from Brigham and Women's Hospital. We'll have more news in just a moment.